Good afternoon. My name is Bill Gravell, and I'm the Williamson County Judge. I do have some new information and some good information to share with you about what is going on in Williamson County. Every day, I'm just completely impressed at the grit of our Texans and how we work together to solve problems. As of now, we have 63 confirmed cases of the coronavirus, and so far we have one person that's deceased. But as I look at the board that matters to me the most is the one with our hospital population, and currently we have 8 individuals that are 11 individuals that are in intensive care and 8 that are currently on ventilators. So we have people literally fighting for their life. Some of the information that I want to share with you today is that our Williamson County and City's Health District is doing really a good job at protecting our residents. And I just want to tell you about some of the successes that we've had. We've been collecting personal protective equipment and giving that out to our first responders across the county. In fact, we've set up our own pod system where those first responders or cities or municipalities can respond to our pod to pick up equipment. I just drove through that a few minutes ago with a sheriff, and I'm grateful for that. I would tell you candidly, though, that even our resources as a county are limited, and we're making those available to first responders. We're making those available to hospitals, nursing homes, and we're making those resources available to local funeral homes. Our folks are working hard to protect us on the front line. Our state and federal partners have worked with us, and we're working together on creating a low acuity care center that we hope in the next few days we'll be able to give you more information. I want to give you a little bit, though, that is exciting to me. There's a local business that's a great corporate partner in Central Texas that is providing us a 150,000 square foot facility, and we'll have the ability to stand up 1,500 hospital beds for a low acute care center if needed. Now, what's important about that information is the organizations provided the space, the county's forward-leaning with the local cities, and we'll be able to provide security. But we can't have that facility unless it's approved by the state of Texas. We've put in that formal request. We're awaiting a response from them. We certainly want to partner with our state and our federal partners. But I just want to say thank you to local business. There have been some local businesses that are big names that you would know. And can I give you 2 examples? There was some equipment that we needed urgently from Apple. And guess what? The vice president of Apple personally delivered it to our headquarters, our emergency communications center. There were some laptops that we needed from Dell. Everything we have is technology driven. And in their factory or plant, I believe in Tennessee, they were able not just to manufacture additional laptops for us, but for some of our cities as well. Major corporate friends like that have just really stepped out. We put out a request today to our friends at Dell, asking them for any additional supplies that they may not be using, if they could share those back with the county. Another corporate sponsor that has just stepped up, and I guess really a corporate partner, is Home Depot, and providing respirators and a breathing mask and dust mask. And so, look, the big names are doing everything they can to help our community. And then we have the small companies like the local brewery that is still manufacturing for us hand sanitizers. I was at our pod a while ago, and they literally had 5-gallon buckets of homemade hand sanitizer that was manufactured in Cedar Park, and that was manufactured in Liberty Hill, and that's been manufactured in Georgetown. So I'm grateful. I think the solution for the challenge we face, if I can just be candid, the solution's not in Washington, D.C., and I don't even believe the solution's in Austin, Texas. I believe the solution is in the heart and in the homes of every citizen of Central Texas. So I'm grateful for their collaboration. We've also got a call center set up, and this is important to me because we take inbound calls of people that may have needs in our community. But starting yesterday morning at 8:30 in the morning, we began calls going out to every veteran in Williamson County. Now, it may take us some days to do that, but do you know what we have? We have staff that is willing, we have technology that can get it out, and we have seniors that need a connection. We're going to reach out to every veteran that's ever served our nation in Williamson County if they'll take our call. So we're averaging a call a minute on our outbound calls at the call center. And by the way, if we find a need there, we're shifting it to our volunteer coordinators, and they're taking care of those needs. I have to tell you why the veterans matter so much to me. I have sat on the porch with Al Blanchke, who's 101 years old in Sun City, and he talked to me about World War II and the Great Depression. And on his 100th birthday, he jumped out of a plane, skydiving. And when I think about the sacrifices he described to me as a young man during World War II, I think the sacrifices that we're facing today are nothing compared to what the greatest generation went through. And so we're checking out the greatest generation. I also sent out a special request yesterday for all Williamson County residents, and I would challenge all of you to do the same. Listen, what we're facing in this pandemic is not a Republican issue. It's not a Democrat issue. What we're facing in this pandemic, are you ready for this? It's not a Protestant issue. It's not a Catholic issue. What we're facing in this pandemic is the greatest challenge this generation has ever faced. And so I want to challenge everyone who lives in Central Texas. If you have a flag at your home, and if you are physically able to do so, I challenge you to do this. At sunrise, with appropriate social distancing, put your American flag up. And at sunset, with all due respect, bring our American flag down if it's not lit. Listen, this is a time where we have to come together as a nation, and where we're coming together as a nation locally. So I want to challenge you in joining us by putting up your American flag.
All right. The first one is, what are we doing right as a county? Are there people or departments you want to brag about that they can share?
What are we doing right as a county? I think the better question is, what are we doing wrong as a county? I've seen our county, Williamson County, transition and metamorphose itself, is that the word, in the last 2 weeks like I've never seen before. Our criminal justice system that was sitting on the bench in a robe with a courtroom with a bailer and a reporter now does it all like we're doing it right now. Every hearing today in our court systems is virtual. We couldn't do that 2 weeks ago. That's something we're doing really, really well. Our sheriff has taken the lead in the initiative with all the local law enforcement agencies, and they are literally marching together arm in arm, doing the right thing to protect our community. And by the way, could I remind you about social distancing? It's not a recommendation. It's not a suggestion. It's just, would you guys please just practice social distancing? I can prove to you, based upon the numbers that we have and the UT study that we have, that 50% of the people are going to die that are age 65 and older if we don't practice social distancing today. It may not affect that 3-year-old, or it may not affect that 30-year-old, but it will affect those that contract the coronavirus that are in that older age bracket. That older age bracket may be old people to you, but I want to tell you, in my mind, they're the most valuable people that live in all of Central Texas. But they're the most vulnerable people that live there as well. So Williamson County is doing a lot of things great. I dare someone to tell me something we're not doing great, and I'm not being arrogant.
Is there any update on the number of tests that have been administered, and are the rapid tests in use yet? In
Williamson County, currently we are in possession of 113 tests. That's all we have. The rapid tests that have been rolled out and that some others are using, they're not being used in Williamson County. And I'd like to explain why. We have a medical director, and she has 2 doctors now that work on her staff, 3 of the smartest medical minds that we know. And the one thing that I ask them is, please, please, please do not put a test in front of us unless it is FDA approved or FDA emergency approved. The worst thing that I can do is to put some test out there that is unproven and test our first responders and give them a false sense or hope that they're okay. I do not have a high standard of low expectations. I have a high standard of high expectations. And so we're working hard to gain additional tests. that are FDA approved and FDA sanctioned. It's complicated, but I would also caution all of the media outlets as well. There's a whole lot of folks out there trying to sell things that are not FDA approved. And unfortunately, there are residents that are taking advantage of that, being given a false sense of hope that everything's okay. Be careful what test you take and make sure that it's FDA approved.
Okay. Nearly a third of the cases confirmed in Williamson County have already recovered. What can be attributed to that? Early diagnosing, self-quarantining, anything that we can attribute to that?
Well, I would tell you this, the stay home, stay safe order that we implemented early, that other ones looked at us and said, why are you guys moving so quickly with this? Is I worked in our county, we worked together with Travis County. We worked with Judge Eckhart. We worked with her staff. We worked with the UT modeling. And I was willing and she was willing and we were willing to take the risk together to step out there early. In the end, we'll let the critics decide if the decision was too early or too late. But I have to tell you, in comparison to some other counties our size, the number of confirmed cases that we have is considerably less, and the recovery rate appears to be a little higher. But before you get too optimistic, let me say this. We don't have any test kits. We don't know what we don't know. I think the stay home, stay safe order was important. I think people applying social distancing is important. I have to tell you, and I bragged earlier, but if it wouldn't be the media and the media sharing this message, how would we ever get it out to the public? So I think the media deserves credit for this as well. You often get criticism, but you never get credit when you save lives, and you deserve credit for this.
Have you determined any of the trends or markers that may tell us we're on the way out of this crisis?
I would tell you, based upon the numbers that we've been provided, the numbers that we're looking at with the UT study, the numbers that are being given to us by our epidemiologists, if I can be candid with you, we've only begun this process. We are not headed out of this process in the next few days. I would also share, too, that I use the analogy with our senior team and our emergency management team that this is my 63rd day to work on it. But if you look at this like a 26-mile marathon, and I'm just making an uneducated guess here, I would tell you that we're in about mile 5 of this marathon. And I would tell you that it's going to take time with social distancing, some patience. It's going to take some time for us to get testing that's available. It's going to take some time for the seasons to change. It's going to take some time for equipment to get here for community to protect our people. It's going to take some time, but this is candidly, we're closer to the start of this than even the middle of this.
How many tests are we doing per day?
That's an answer that I don't know. We don't know the answer to. I know one of the major hospital providers in the area that has facilities from Waco all the way to Austin, all they have is 60 tests. We have some private, emergency rooms that have popped up, and they have some tests there. But the reality is we don't know how many tests we're performing a day. I have an idea of how many tests we're providing for first responders and for families and for critical folks. I'd have to tell you, one of the top priority for this county judge in testing with our kits is if we have any senior adults that are in any of our nursing homes that are close. We want to test them. And by the way, to my knowledge, as of this moment, the ones we have tested have come back negative. So I'm grateful for that. But I'm forward leaning to make sure that our senior adults are taken care of first in our nursing homes and that our first responders are taken care of secondarily.
Is there anything that we can do to help you as judge? Not just to help the county and its people, but for you personally?
Just be patient and understand that what county elected officials are going through is the most difficult days that we've ever been through. And I would not want to offend anyone with this. But if you're a person of faith and you believe in God, the one thing that I would ask as the Williamson County judge is that you would pray for wisdom. You would pray for wisdom in the decisions that are made in this room, because there are decisions that are made in this room, not only that affect people's livelihood, but more importantly, affect their life. And so, in a selfish way, the greatest need I have right now is wisdom to make the right decisions.